This tablet is a combination of vitamins and minerals that is used to treat or prevent vitamin deficiency caused by a poor diet, certain illnesses, or during pregnancy. Vitamins are essential for the body and play a crucial role in maintaining good health. It is important to take this tablet as directed by your doctor in order to benefit from its full effects. It is recommended to take this tablet with a meal to help with absorption. Be sure to follow the dosage instructions provided by your healthcare provider for the best results. When taking this medication, it is important to follow the instructions provided by your doctor or on the product packaging. Typically, it is taken once a day by mouth. It is important not to exceed the recommended dosage. If you have any questions, it's best to consult your doctor or pharmacist. In order to receive the maximum benefit from this medication, it should be taken regularly. To help with consistency, try taking it at the same time each day. Some common side effects of Multivit: calcium, Min-Folic acid 240 Mcg-D3 25 Mcg-Lycop 300 Mcg tablet include constipation, diarrhea, or upset stomach. These effects are usually temporary and may go away as your body adjusts to the medication. If they persist or worsen, it's important to consult your doctor or pharmacist. If your doctor has prescribed this medication, it's because they have determined that the benefits outweigh the potential risks of side effects. However, it's important to note that not everyone experiences serious side effects from this medication. Although rare, a serious allergic reaction to this drug is possible. Seek immediate medical attention if you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or difficulty breathing. It's important to remember that this is not a complete list of possible side effects. If you experience any other unusual effects, it's recommended to consult your doctor or pharmacist. As for the optimal timing and dosage, it's best to follow the instructions provided by your doctor. Typically, this medication is taken once a day with or without food, as directed by your healthcare professional. Be sure to take it regularly to get the most benefit from it. If your multivitamin contains iron, it's crucial to keep it away from children to prevent accidental overdose. Iron overdose is a leading cause of fatal poisoning in children under 6 years old. If overdose occurs, seek medical help immediately or contact a poison control center. Before taking this multivitamin and mineral supplement, it's important to talk to your doctor or pharmacist if you have any allergies to its ingredients, soy or peanuts, or if you have any other allergies. This product may also contain inactive ingredients that can cause allergic reactions or other problems, so it's best to consult with your pharmacist for more details. It's also important to discuss your medical history with your doctor or pharmacist before taking this supplement, especially if you have a history of alcohol use or abuse, liver problems, or stomach/intestinal problems such as ulcers or colitis. If your multivitamin contains folic acid, be sure to inform your doctor or pharmacist if you have a vitamin B12 deficiency, pernicious anemia, before taking it. Folic acid may affect certain lab tests for vitamin B12 deficiency without treating this anemia. Untreated vitamin B12 deficiency may result in serious nerve problems, so it's important to consult with your doctor or pharmacist for details. Before undergoing surgery, it's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or breastfeeding, it's important to discuss using this medication with your doctor before starting. It's important to be aware of potential drug interactions when taking Multivit: calcium, Min-Folic acid 240 Mcg-D3 25 Mcg-Lycop 300 Mcg tablet. If your multivitamin contains iron, it's best to avoid taking it at the same time as antacids, bisphosphonates, levodopa, thyroid medications, or certain antibiotics. Be sure to consult your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that works with all your medications. If your multivitamin contains folic acid, it's important to inform your doctor or pharmacist if you take certain anti-seizure drugs. Additionally, this medication may interfere with certain lab tests, possibly causing false results. It's important to make sure that lab personnel and all your doctors are aware that you are taking this medication. As for the best time to take this medication, it's recommended to follow the dosing schedule provided by your doctor or pharmacist. Be sure to take it as directed and do not start, stop, or change the dosage without consulting your doctor. If you or someone you know has taken too much of this medication and are experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911. Otherwise, you can contact a poison control center for assistance. In the US, you can call 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. Be sure to keep all your scheduled medical and lab appointments. In addition to the listed ingredients, some brands of this product may also contain docusate. If you have any questions about the specific ingredients in your brand, be sure to consult with your doctor or pharmacist. It's important to note that this product is not meant to replace a healthy diet. It's always best to get your vitamins from nutritious foods. Make sure to maintain a well-balanced diet and follow any dietary guidelines given to you by your healthcare provider. If you are taking this medication regularly and forget to take a dose, take it as soon as you remember. If it is close to the time for your next dose, just skip the missed dose and take the next one at your regular scheduled time. Do not take a double dose to make up for the missed one. When it comes to storing Multivit, calcium, Min-Folic acid 240 Mcg-D3 25 Mcg-Lycop 300 Mcg tablet, it's important to keep it at room temperature and away from light and moisture. Avoid storing it in the bathroom and always keep it out of reach of children and pets. Additionally, it's crucial to properly dispose of this product when it's expired or no longer needed. Do not flush it down the toilet or pour it into a drain unless instructed to do so. It's best to consult your pharmacist or local waste disposal company for the proper way to discard this medication. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.